Good morning, everybody. I'm Army Parala Metz. I am the section chief in senior oncology here at Atrium Health Levine Cancer. And today we're doing our third in our 4Ms educational series. And this is in relation to the age-friendly health system designation that we have. So age-friendly health system is an initiative of the John A. Hartford Foundation and the Institute for Healthcare Improvement, or IHI, in partnership with the American Hospital Association and the Catholic Health Association in the United States. An age-friendly health system aims to follow essential set of evidence-based practices that will cause no harm and align with what matters most to the older adult and their family caregivers. Um, Next slide. So this touches on the 4Ms, which is a framework of care that focuses on what matters most, on medication, mentation, and mobility. And this morning we will be talking about the one of the M's, which is in relation to medications. Next slide. We are there are two levels of recognition for age-friendly health system. One is the participant level, where over 4,000 health practices are part of it, and only 2,000 health practices or care institutions have achieved the committed to care excellence level of recognition. Next slide. We are very proud to share that Atrium Health Levine Cancer Union West and Atrium Health Wake Forest Baptist Comprehensive Cancer Center out in Winston-Salem have achieved level 1 or participant level of age-friendly designation. And our campuses here in Moorhead and Pineville for Atrium Health Levine Cancer have achieved the Committed to Care Excellence for Older Adults level of recognition. And we are the only cancer center in North Carolina who have achieved the level 2 designation from IHI. Next slide. So this morning, we are going to have, as I mentioned earlier, focus on the one of the M's, which is medications, and we are very happy to have uh, Abby Ray, who is a PharmD, who recently joined us um, in August in the Department of Supportive Oncology. She is a clinical pharmacist originally from Hollidaysburg, Pennsylvania, and earned her Doctor of Pharmacy degree from the University of Pittsburgh School of Pharmacy. Dr. Ray completed her postgraduate residency training in Pittsburgh at UPMC St. Margaret Hospital, where she specialized in geriatrics. Outside of work, she enjoys exploring new restaurants, reading, and spending time with her two cats. So, welcome, Dr. Ray, and thank you for giving this talk on polypharmacy.
Thank you so much for having me. I'm happy to be here. So I am going to be presenting on polypharmacy, like Dr. Metz had mentioned. So thank you so much for having me. I do want to preface this presentation with, please feel free to interrupt me throughout. I want to make this as interactive and helpful to you as possible. So if there's questions that come up or you need clarification on any slide, just, raise your hand, throw something in the chat, or just speak up. So thank you. All right, so I do have some objectives for today. So my hope is that by the end of this presentation, you'll be able to define appropriate versus inappropriate polypharmacy, understand some of the causes and consequences of polypharmacy, and then identify methods to actually manage polypharmacy. So first, we need to define polypharmacy. So polypharmacy is very broadly defined as the regular use of multiple medications. This makes sense from a purely linguistic perspective, poly meaning many, pharmacy relating to pharmaceuticals or medications. Another definition that is widely accepted is the regular use of 5 or more medications. We don't really have 100% consensus in the medical field on what should be regarded as polypharmacy, but there are some ongoing efforts, and I'll discuss this in a little bit, to kind of improve this definition. So with the continual development of new drugs and existing medications that are now receiving indications for other conditions that they were, not originally made for, but we found that they're helpful, This has certainly led to medication use being on the rise. It's pretty, it's hard to quantify medication use, especially on a large scale as far as, what is the actual use in the United States. So I actually had a hard time finding any newer figures than this that were reflective of the US population as a whole. But as you can see here, between 2017 and 2018, it was found that 17.1% of all adults in the United States were taking five or more medications. Amongst older adults, so 65 and older, 44.1% were taking five or more medications. And then polypharmacy was considerably more prevalent in certain disease states or conditions. So, for example, heart disease, about 62% of patients with heart disease were taking five or more medications, and about 58% of patients with diabetes were taking five or more medications. I would argue that these numbers are probably higher in the 2024, though that is just me abstracting, but certainly a very prevalent problem. So, why do we care? Why am I giving this education today? We know that there's many negative consequences of polypharmacy, and they tend to be very interrelated. So all of the things that you kind of see on this slide are all related somehow. But I would say the first thing that usually comes to mind with taking many medications is the inconvenience of taking many medications. So we know from studies that the more medications a person takes, the more frequently, or the more frequently they have to take a medication throughout the day, the more likely they are to not take the medication properly. They're more likely to miss doses, or they're more likely to just not take it at all. Um, so this can lead to medications failing to provide the benefit that they were prescribed. It can lead to, side effects, withdrawing from medications if you're not taking it, dose, stacking if you forget a dose and then you take two at once. So this alone can cause problems, and also just can prevent, the efficacy. So it can lead to disease progression, worsening of symptoms, or development of new conditions and problems. And then drug-drug interactions is also a lot more likely the more medications you add to a person's list. So the more medications someone takes, the higher likelihood that they may interact with each other. And we can see a variety of things happen when medications interact. So one drug can decrease the efficacy of another, which can then lead to worsening of illness or symptoms. Some medications are known to interact in the other way, where they actually make one medication stick around in the body longer, which then can kind of tie into the next thing I have listed, which is side effects. So we can see additive effects of medications. We can see multiplicative effects of medications where when just taking one medication, side effects are minimal, but you add another medication that also has the same side effect, and we just see, a very severe side effect from that medication. And like these interactions, side effects can be pretty minor or they can range to being severe. So, something just like stomach upset, a minor side effect, still inconvenient, but minor. But what we really are worried about is the more serious side effects that can be caused from multiple medication interactions. Um, and that is kind of where everything else on this slide kind of ties in. So, for example, medications can cause low blood pressure, leading to falls, or they can cause just more generalized weakness that can lead to mobility issues, which then can also lead to falls. Certain medications, both prescription and over the counter medications, are known to worsen memory or cognition, which can lead to increased confusion. Um, and then that can lead to just a generalized functional decline, loss of independence, which we don't want for anyone. And then, even worse, multiple medications with all these side effects could lead to emergency department visits, hospitalizations, which are costly. Medications alone are costly. And then, probably most importantly, is just polypharmacy in general can lead to an overall decrease in a person's quality of life. So now that I've caused you to panic because you or a loved one are taking 5 or more medications, and you're trying to figure out why a pharmacist is telling you that medications are bad, I want to bring up an important clarification or question, I guess, and that's, does more medications always equal more problems? So that's what I'm hoping to kind of clarify here. So, new data argues no, medications do not necessarily cause more problems. So, this is where my problem with a lot of the definitions that are commonly used for polypharmacy kind of don't make sense. So, using a simple threshold of if it's less than 5, you're good, if it's more than 5, automatically bad. Um, that simple cutoff doesn't really tell us whether the medications are or are not appropriate. So we know that appropriately managing someone's medications with, targeted medications for their conditions can prevent hospitalizations, can prevent progression of disease and other bad things. So I am hoping that what you'll take away from this presentation is that there is an important distinction between appropriate and inappropriate medication use. And that's what I have here. So, trying to just shift this focus from um, saying taking multiple medications is bad to taking inappropriate medications causes more problems. So this is kind of the narrative that we're trying to shift away from. So polypharmacy in its most basic definition is viewed as something to be avoided, but unfortunately, this is not realistic for most people. We know as we age, we are more likely to need medications. We're more likely to develop multiple chronic conditions, and this is unavoidable most of the time. So a larger number of medications may be necessary in the proper medical management of someone's medical conditions. So instead, we need to try and shift the focus of differentiating between inappropriate polypharmacy from appropriate polypharmacy. And appropriate polypharmacy being where all medications are prescribed to achieve specific objectives, and the therapy has been optimized to minimize side effects. So, defining inappropriate polypharmacy, this is certainly not, an exhaustive list, but I would say that inappropriate polypharmacy is present when 1 or more medications are prescribed that are not needed because either there's no clear indication for them, we're not sure why a person's taking it, which more commonly happens when a medication was originally prescribed for a specific indication, but now that does not require treatment. Um, Someone had hypertension, high blood pressure when they were in their 50s. Now we're seeing them in their 70s and, they've lost some weight, things look good. They don't need that anymore. Another example would be a medication that hasn't achieved its therapeutic goal. So we started someone on a blood pressure medicine, their blood pressure is still not at goal, and we're able to get it at goal with a different agent. So the one that wasn't effective doesn't need to be on the list anymore. And then finally, a medication or combination of medications causes an unacceptable side effect. Appropriate polypharmacy, on the other hand, is going to be present when all medications are prescribed for a specific goal. The goals are actually being achieved. So we're reaching that blood pressure goal, we're reaching that symptom goal. The medication regimen has been optimized to prevent side effects, and the patient is motivated and able to take all of the medications. So that's another piece is having multiple medications that may be beneficial for someone are not going to provide that benefit if they are not able to take the medications properly. So, in summary, appropriate polypharmacy benefits of medications outweigh the risk. There's a clear indication for these medications, and we're using an evidence based approach when prescribing. Versus inappropriate polypharmacy, the risk of the harm of a medication is exceeding any potential benefit that someone might gain, and there's no clear indication for the medication. So, looking at kind of how we get to polypharmacy, there's a lot of different risk factors that can lead to polypharmacy. Um, we've already kind of talked on this, but older age. So, a prevalence of medical conditions increases as we age. So, aging alone is likely to lead to the need for more medication. Multiple chronic conditions along the same lines, certain conditions such as heart failure or high blood pressure might require multiple medications to appropriately manage. And again, as long as those medications aren't causing side effects, they are going to benefit the person and lead to worsening of illness down the line. Seeing multiple subspecialists kind of along the same lines as chronic conditions. You have multiple different um, hands in the pot, I guess, and can have uh, polypharmacy kind of happen from that perspective. And then another thing I think we're seeing commonly, or maybe I'm just noticing it more, but there's been an increase in herbal and alternative medicine use. So over the last few years, I feel like I've seen an increase in these herbals and alternative medicine. So while these medications or herbals, may have some benefit, they're also adding another pill to someone's regimen. Sometimes they're dosed multiple times a day, or it's a powder that needs to be dissolved in water. So it just adds a level of complexity that may not really add that much benefit to someone's regimen. And then some healthcare system factors that can kind of lead to polypharmacy. So, infrequent medication review, where we're failing to capture changes that might be made at a doctor's office outside the system, or we're failing to add those OTCs and herbal supplements to a person's list. So, we really don't have an accurate medication list for a patient. Um, the inappropriate use of automated refill systems. I'll get into this a little bit later too, but um, these automated refill systems are a great tool, but they need to be used strategically as they may inappropriately refill medications. If doses are changed, they might refill the wrong strength. Medications that have been stopped might accidentally be refilled. So this can lead to inappropriate use of medications. Prescribing guidelines are another thing we have from a prescriber perspective, medication perspective. We have all these great guidelines that tell us all the medications that are beneficial for different chronic conditions. But a lot of times these are very focused on a single condition and they don't offer guidance on how to look at a patient from a big picture. So, 5 agents might be recommended for someone with heart failure, but we're failing to consider what medications we might be able to get, dual use out of based on the other conditions that they have. And then something called a prescribing cascade, which is what I'm going to go over on the next slide. So, the prescribing cascade is defined as a sequence of events that begins when an adverse drug event or a side effect occurs. It's misinterpreted as a new medical condition, and then another drug is then prescribed to treat that new condition that isn't actually a new condition. It's just a side effect of the first medication. So for visual people, I have that on this slide. So medicine one is prescribed, take it for a few weeks, start to have a side effect. You are maybe prescribed something by a specialist. You start just feeling kind of generally unwell, dizziness. So you're going more to your primary care doctor. They may not know about that new medication that was started. They may not know that it is new. They may have thought that you'd been taking it for a few years, so they're not really making that connection to the new medication. So they're, thinking this is a new condition that you may have developed. They're prescribing another medication, and then it's just, kind of an endless cycle that can be really detrimental to patients. All right. So how do we actually manage this? I don't want to, you know, bring down the negativity here. So I do want to give everyone some, practical tips for how we can actually make sure that we're either avoiding polypharmacy or we're ensuring that we're using appropriate polypharmacy and avoiding inappropriate polypharmacy. So I have this broken down into kind of two different management ways. So the first being identifying and preventing any inappropriate polypharmacy. And then later we'll go into some management tips if you do have appropriate polypharmacy. All right, so first, identifying and preventing inappropriate polypharmacy. My first tip is to bring your medication list to your appointments. I know it can seem tedious. I hear this all the time. It seems really repetitive at every single doctor's visit to review your medication list. But I think something that's important to remember is just that computers can miss things, humans can miss things, and it's always best to just make sure that all of your healthcare team is on the same page when it comes to what medications you are taking. So, unfortunately, a limitation to the medical system is that there is no universal chart for you. There's no chart that every single doctor that's ever seen you can access. Within the same system, they do communicate, but if you see an outside doctor, outside the Atrium Health system, we may not necessarily have access to their records. So, best practice is just double check each time. Um, and when you're actually making this medication list, make sure that you're being specific. So, including the dose of the medication. So, what is the tablet strength? Is it Tylenol extra strength, the 500 milligram tablet, or is it Tylenol regular strength, the 325 milligram tablet? Or is it the arthritis strength, to make it even more confusing, the 650 milligram tablet? So, when you say, "Oh, I take 2 tablets a day," that can be a big difference of, how much you can take in a day based on the tablet strength you have at home. So, um, always include the strength, always include the number of tablets that you're taking and how many times a day you take them. Also important to mention whether you take it as needed or more on a scheduled basis. And then being specific, I see this all the time. This is my, pharmacist pet peeve, but 2 tablets a day. In my brain, what does this mean? Is that one tablet that you take 2 times a day, morning and night? Is that 2 tablets that you take together at the same time in the morning? Um, just be specific. It helps, I promise. And then I think something that people don't realize is over the counter herbal and alternative medicines or supplements, those count too. We want to know about those as well. Um, and then keep it updated as things change. So that's why I recommend bringing it to your appointment so you can update it in real time. You can make annotations in real time as things change. I'm a note taker, so I know that's something that would have to do is write things down as they change, and always bring that to your appointments so that you can kind of compare with the clinic. And I think I have that on the next slide. Yes. So communicate all medication changes to your care team. So not only have your list and bring your list to the appointment, but actually make sure that you're going over it with your doctor's office at your visit. I know a lot of times at the end of the visit, you'll get the printout, your after visit summary that usually has a med list on it. um, Take the time to look at that and actually make sure things match up. I mean, we should ideally be double checking that before that prints out, but things happen. So just use that as a way to just like cross check each time, make sure everything's right. Um, and then, yeah, any changes that happen might not be communicated. If you see Dr. A on Monday and Dr. B on Thursday, might not be updated with Dr. B. So just, letting them know, hey, this changed recently. And that's where that medication list also comes in handy because you can annotate. All right. And then it is always, always our preference that you ask about OTC or herbal medications or supplements before you actually start. This is very, very common misconception that something available without a prescription means it's safe. That is not the case. Available without a prescription does not equal safe for everyone. There are many interactions that exist with a lot of these supplements. There are, max doses for different over-the-counter medications based on your kidney function or your liver function. So just make sure to double check before you start it. We just don't want these to interact and cause side effects. We don't want them to interact and decrease how effective your prescription medications are. So that is always our preference. Or ask your pharmacist, ask me. um, all right, and then know what you're picking up from the pharmacy. So my first bullet here is try to use the same pharmacy. I know this can be difficult with, different insurances preferring mail order, but sometimes if a change is made, that day you want to pick it up at your local pharmacy so that you can get the medication. So do your best to try to use the same pharmacy. And this is because if a medication dose or instruction is changed, if it's sent to the same pharmacy that had the old prescription, the pharmacist can, update that. They can make sure that you don't accidentally fill the old dose versus, if you have your Tylenol 325 milligram prescription at the CVS and you have the 500 milligram prescription at Rite Aid, they don't know that the other is filling, and that can just lead to confusion. So trying to fill it at the same pharmacist or pharmacy when you can. Um, ensure you're not picking up medications that you aren't taking anymore. I know this one might seem really obvious, but I can say from personal experience, walking up to the pharmacy counter, they say, "Oh, we have one medication ready for you. We have two medications ready for you. Is that correct?" But they don't always say which medication that they have ready, and sometimes that is purposeful, for privacy purposes, etc. But um, just make sure that if you aren't sure what you're picking up, that you're clarifying with them, asking them what the medication is, as well as the dose, just to make sure that you're not picking up something that you shouldn't be taking anymore. And then, excuse me, as promised, I said I would say a little bit more about the automatic refill services. So just know that this is a tool. Computers don't know everything. I know we want them to, but they don't. Or maybe we don't want them to. I don't know. But these systems are are not designed to take into account any dose changes that you have. They're not designed to take into account when a medication is taken as needed. So, you'll get a prescription for Zofran for nausea every 8 hours as needed. The system is going to refill that every 30 days or however long that prescription's written for, when if you're only needing it a few times a week, you don't need to keep paying for that prescription. So just be mindful of these refill services. If you notice something is on automatic refill that you're not taking regularly, you can always ask the pharmacy to take it off that autofill service. All right, so then moving on to management tips when you have appropriate polypharmacy, but you're still taking a lot of medications, and we just want to make sure that you're managing them correctly. So, my first one is still keeping your own medication list. That kind of goes for both, but even if all of your medications are correct and everything is optimized and you're not having any side effects, that is always our goal, but we still want to make sure that we're keeping track of our medications, that you know exactly when you're taking them, how often you're supposed to take them, and any changes that happen are getting implemented when you get home. Um, and then, yeah, I think that was about it. Just making sure that everything you're keeping on top of it, um, and everything stays appropriate. Sticking to a medication schedule, I think this is the one that people have the most difficulty with, and reasonably so, especially if you're taking medications, um, that are multiple times a day. You have some that you have to take with meals, you have some that you can't take with meals. Keeping a schedule or a calendar can be really, really helpful for people. So, even if it's just a handwritten chart, on a piece of paper that you make each row a medication, and you make 4 or 5 columns that say when each is supposed to be taken, which ones need to be taken in the morning before breakfast, which ones need to be taken with breakfast, with lunch, dinner, etc. They also make printable templates for these. So I found several online that were just, free templates that you can print out. You can type in the medications before you print them and update them, or you can just print it blank and handwrite all of your medications in. And a lot of these were really nice because they, have the name of the medication, they have the dose of the medication, like the tablet strength, and then how many times a day to take them. Trying a pill box is helpful. I think that can be helpful, especially if you're someone who, you take your medications, you go to get ready, and then can't remember an hour later if you took them already. That's really where the pill box can be beneficial. They make so many different kinds of pill boxes now. They make ones, that you can travel with, that you can take the day of pills with you. So if you know you're going to be out of the house, they make ones that have, 4 slots a day for when you need to take meds at, in the morning, dinner, and bedtime. So there's a lot of really cool tools out there. Mindful with the pill boxes though, when things change. So if you have, a medication dose that's decreased, the limitation of the pill box is that you have to take out each of those pills then that you've maybe already set up for the week and then switch them out. So just make sure that you know which medication is which. It can be helpful even to write, a description of the pill on your little chart, or keep the bottle. All of the bottles from the pharmacy should have a description of what that medication looks like, just so you can keep track. Um, as needed medications are the other, I guess, limitation to pill boxes. So if you have something like Zofran as needed or a pain medication as needed, we certainly don't want you putting that in the pill box and inadvertently taking it when you may not need it. And then lastly, if you find that it's hard to remember to stick to a schedule, trying alarms can be helpful. So setting a phone alarm. I have a picture at the end of this presentation actually that has a pill box that has a timer, a little alarm on it, which is new to me. So I think there's a lot of tools out there now that can help with these concerns. But you also have pharmacists. So, shameless plug for me. If you ever have any concerns about your medications, you're having a hard time remembering to take them, um, I am a resource that's available here at the Department of Supportive Oncology. Community pharmacists at different pharmacies are a resource that can really help you um, just answer general medication questions. They can help you figure out, what pill box might be best or what the best way to manage your medications might be. So um, I think that we are a very helpful resource. So I'm glad to be here. And I think something that I like to say is everyone needs a medication checkup. So we're familiar with going to your primary doctor once a year for, your annual wellness visit. But where's the annual wellness visit for your medications? You still need to check up on your medications too. So that's, a service that I'm happy to provide here as well, especially in the Department of Senior Oncology, doing kind of comprehensive medication reviews to ensure that we have an accurate medication list and we're also identifying medications that might not be necessary anymore because if you don't have to take a medication, I think most people would appreciate that. So all right. And then this was the slide that I mentioned a little bit earlier. So this picture on the far left is a example medication schedule that I found online that was a, printable template. So it has columns to put the medication, the dose, and then how many, when you should take it throughout the day. It has who the prescriber is and ways to take different notes. So definitely something to look into. They make these super handy bottle caps that you put on the pill bottle instead of the one that comes with it from the pharmacy. And this helps you know when it was last opened. So this is also beneficial for someone who maybe doesn't like the pill boxes, but might have a situation where you don't remember if you took it this morning. And you go back and that way you can see, oh, I opened it an hour ago. Okay, I'm good for the day. Um, the free alternative to that is something that pharmacists will often recommend is turning the pill bottle over. So once you've taken it in the morning, flip it upside down so that you know that you've taken it that morning. And then if there's an evening dose, kind of flip it back. So that can also be a helpful tool that doesn't require purchasing anything. Um, this little pill box is what I was saying, if you take things on the go, if you're worried about missing the lunchtime dose of something, they make little pill boxes where you can just take each day and it can just fit in your pocket or purse. And then this was the really cool alarm pill box that I found. All of these were on Walmart, by the way, so they're definitely accessible. I'm sure that Amazon and other, large retailers have similar. So these are my references. I'm happy to answer any questions.
Thank you very much, Abby. That was very helpful, and something that we always reinforce with our patients, especially when we're seeing patients with a lot of medication. It's hard to keep track of, and oftentimes when I see patients in clinic, they are more than happy to review the medications because it could become very overwhelming. Their day revolves around taking pills. Um, uh, I have a question for you. And mentioned about supplements. Most people, when we see them, they get advice on taking vitamins. They get advice on taking nutritional supplements, either through social media, where they get ads and get information from family members or from other sources. Do you have any recommendation on where most patients can check that is reliable in regarding supplements, herbal supplements? Do you have anything like that you can recommend?
Yes. So, Memorial Sloan Kettering, so MSK, has a health system has a free website that they have, like a patient-friendly guide to herbal supplements. So that's usually the one that I direct people towards. I think if you just type in MSK herbal into, your search engine of choice, that comes up and you can actually search the specific herbal, and it kind of has a option to select if you're a patient, and it gives you a really nice kind of summary of what the supplement might be used for, but also gives some kind of general warnings or potential interactions.
Thank you very much.
Thank you, Dr. Prelamatz. Does anybody else have any questions? I also wanted to mention that I've had a patient successful with pill packs. I found a specialty pharmacy that was willing to do pill packs and actually put the time of day before breakfast, afternoon, bedtime, and kind of words that are good reminders for the patient. So that's not at every pharmacy, though. It took some work to find that type of pharmacy that was willing to do that. It's kind of a dispensary box for the month of pill packs.
I thank you so much for bringing that up because I forgot to mention those. But yes, that is definitely a resource that is helpful. It's like a pill box, but someone does it for you. And a lot of times they're super nice. They have pictures of, each medication. So that's definitely an option as well. Thank you.
Well, we're thankful everybody joined us today. We're thankful for your expertise. Abby, we're so happy you're in our department and a resource for us. Anybody else? No questions? Dr. Prelamatz, you want to close?
I think Jean is typing something, so I just wanted to wait until it comes through.
Okay, sure.
This is our third of the 4M series, and we have another educational talk at the end of the year. That will be the last of the quarter, the last of the 4Ms, and that will be about what matters most. We'll get information out for that presentation. And again, thank you everybody for joining today.
Thank you so much.
Bye.
Thanks, Abby.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.